My name is Sheila Weaver. I'm a project manager within the Idaho Caregiver Alliance, and I'm also a licensed clinical social worker and an advanced certified alcohol and drug and alcohol counselor. And we are so pleased that you are here to celebrate I don't know if I'd say celebrate's the right word, but you are here to recognize World Mental Health Day with us and really spend this time talking about caring for the caregiver, managing the impact of caregiving on health and well-being. And I'm just thrilled. We have two speakers. We have Marcy Croffy. She's an LCSW. She has more than 30 years of experience as a social worker and facilitator for change within individuals and organizations in professional and volunteer systems. She's worked with diverse populations and rural community mental health, government, and nonprofit settings across the U.S. She is skilled at networking and collaboration and interfaces with various levels of agency personnel to provide clients improved access to services. In her current position at the Boise VA Caregiver Support Program, Marcy engages caregivers in education and training on factors contributing to caregiver burnout and how to better manage resultant stress. And Stacey Lewis is also a licensed clinical social worker. She's been practicing for 23 years. She also currently works in the Caregiver Support Program at the Boise VA. Her professional experience also includes working in inpatient and outpatient medical settings and with adults who have severe and persistent mental illness. Through her professional experience, Stacey has been provided with opportunities to assist individuals and their caregivers. In her personal life, Stacey is a wife and mother to 3 sons. When one of her sons was born with liver disease, she found herself on a healthcare journey, which provided her with a unique perspective of what it means to be a caregiver and the impact caregiving has on the individuals who provide care. So I am so excited to welcome both of them today. I also need to say too, the Boise VA medical system does not always cooperate well with Zoom. So I think we have all the little pieces and parts worked out, but I want to just kind of call that out, that if we have a little glitchy thing, I want to make sure to point the finger at the large government system and nobody in the room.
Yeah.
So with that, I am thrilled to welcome Stacey and Marcy, and I'll let you guys go ahead and take it away from here, and your slides are up.
Sure. Thank you so much. Can everyone hear me okay? Yes? Perfect. All righty. Stacey and I are excited to be able to participate in this conference to increase awareness and support of optimal mental health on this World Mental Health Day 2024. We are social workers, as Sheila mentioned, at the Boise VA. Stacey has been there for 10 years, and I have been there for about a little over a year and a half. So we also have specific programs. There's 2 pieces to caregiver support, and we work in our respective programs. So we'll touch base on that at the end of our talk. Next slide.
Okay.
So these are our objectives. We're going to touch base on the latest demographic information related to the topic that we're speaking on today. We want to recognize effects that caregiving has on the individual's health and well-being. We want to identify signs and symptoms of compassion fatigue, and then share skills to manage the effects of caregiving. Next slide. So these are our missions. Since we do work for VA, there's the VA mission statement, which does incorporate the promise to care for our military, our families, caregivers, and survivors. And then there's the caregiver support mission statement. And this is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. And Stacey and I work on a really awesome team. I've seen a few names in the chat with regards to participants today who are part of one of our programs. So we have an awesome team of social workers and nurses that assist caregivers in several ways. And we are passionate about helping caregivers achieve and maintain balance in their lives so they're better able to support and perform the multiple duties and responsibilities for their care recipients. Next slide. So the second objective is recognizing effects caregiving has on individuals' health and well-being. And as social workers, we often talk about the glass being half full versus half empty. So we like to talk about positive effects or impacts of caregiving first. So here's a couple of bullet points that we have heard from caregivers with regards to how they feel their caregiving role and what it contributes to their lives. And so we hear them say there's a sense of fulfillment, that there's an establishment of extended social networks or friendships. And as part of the education, skill building, and supports, we try to, and we work very much on encouraging those type of relationships. The person feels needed and useful, and they're also learning something about themselves, others, and the meaning of life. So next slide. I really like this picture. It's a mom and a you know, her son, it looks like. We know that each of you in the audience are either currently caregivers or have been one in the past. And then this leads us to a favorite quote, which is the next slide. There are only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who need them. This is from Rosalind Carter, and she's the founder of the Rosalind Carter Institute for Caregivers. And this institute promotes the health, strength, and resilience of family caregivers at every stage of their journey. And speaking of health, and being that this is World Mental Health Day, we want to acknowledge the fact that some of the discussion we have today may trigger uncomfortable feelings. And if that's the case, please feel free to take a quick break and take care of yourself. Next slide. There's a few studies, and we've listed resources and references in a copy of slides that are available if you choose. But these are a few studies that have notable statistics. And we're speaking for military veteran caregivers because that's what we work with. But they report higher levels of stress and depression than non-caregivers and show a greater strain on and general decline in their physical health. And then just Americans overall, 23% of Americans caring for another person report that caregiving has made their health worse, noting they also find it difficult to take care of their own health. 21% of caregivers in the US report feeling alone. And there's a specific program that I do. It's called Reach VA, and it's tailored to specific disease such as dementia, Parkinson's, ALS. And there's a risk assessment I do at the beginning. And these are the questions that we ask. We ask caregivers, is your health the same, better, or worse this year than it was previous? Do you have enough time to do the things you normally used to do to take care of yourself, such as taking walks, making your own medical appointments, those type things? So these statistics are really valid. Next slide, please. As continuing on that same theme, nearly a quarter of caregivers find it hard to take care of their own health, and nearly a quarter say caregiving has made it worse. Finances are huge. Stacey and I hear this a lot. They're concerned. 28% of caregivers have stopped saving. 23% have taken on more debt, because we often know that how that can be with medical costs. And then 22% have used up personal short-term savings. With the hours a week providing care, on average, caregivers spend 23.7 hours a week providing care, with 1 in 3 providing care for 21 hours or more, and 1 in 5 providing care for 41 plus hours, which is the equivalent of a full-time unpaid job. And I'm going to let Stacey speak to some statistics regarding children, since that's going to be a focus of our case study today.
Thanks, Marcy. Okay, so are we advanced to the next slide? Perfect. Okay. All right, so here's some data from the 2022 National Survey of Children's Health. And the question that they asked here is, does the child have special health care needs? And the blue bars are representing the children in Idaho, and the orange bars are the children nationwide. So from this, you can see 20.8% of children nationwide have special health care needs compared to 16.9% of children in Idaho. So we're doing a little bit better there. But the second graph is the flip side of the equation. So 79.2% of children nationwide do not have special health care needs compared to 83.1% of kids in Idaho. So overall, our state has fewer children with special health care needs compared to nationwide. Next slide, please. Okay, so this is more information about how we are doing compared to the nationwide statistics. So this is looking at how the caregivers of these kids with special health care needs are doing. So these are the statistics about overall physical and mental health of their mothers. The question here is, if this child's mother is a primary caregiver and lives in the household, is the mother's physical and mental health both excellent or very good? So national statistics, once again, are in blue, and Idaho statistics are in orange. So the graph shows 58.4% of caregiver mothers nationwide have excellent or very good physical and mental health compared to 52.6% of mothers in Idaho. And the second graph, these last two bars here, shows that 41.6% of mothers nationwide report physical and mental health are not excellent or very good compared to 47.4% in Idaho. So from the information, it seems caregiver mothers in Idaho are struggling more with their physical and mental health. So next slide. Okay. So here, this slide provides information about fathers of these children who are primary caregivers. And so the indicator they measured is if the child's father is the primary caregiver and lives in the household, is the father's physical and mental health both excellent or very good? And so same is true, national statistics in blue, Idaho statistics in orange. And so the slide shows similar numbers, both nationally and locally, for fathers. So most caregiver fathers, about 62 and 63% have both excellent or very good physical and mental health, and 36.6 to 37.6 of caregiver fathers, physical and mental health is not excellent or very good. So at this point, Marcy and I wanted to just pose a question of you. Why do you think this is the case? Why are the caregiver father numbers different than the caregiver mother numbers? And why do you think the numbers are worse for caregiver mothers? What factors might be present here? So we thought we would take maybe 10 minutes for a little breakout discussion so you can talk amongst yourselves, and then get back with us in a few minutes and let us know what you were able to discuss. So there are unique challenges for people with both visible and invisible medical conditions, right? And thinking about that, there might be more understanding and support for those who have visible medical conditions, or, like if somebody's in a wheelchair, or, it's easy to see that they might have a disability. There could be possibly some more understanding and support, but also there could be more judgment, in those situations, or possible discrimination in those situations. So lastly, I wanted to just kind of say, you never know what you are capable of doing, what you're capable of accomplishing until the need arises. Like, that was something that I learned about myself. And people used to say, I don't know how you do it. You know, they would say, gosh, I don't know. How are you doing this? And I would just kind of say, I have no choice. So we all have our own challenges and we all have our own opportunities. And we do our best in these moments, right? Hindsight, is that what it's called? Yeah. That word sounded weird to me. Hindsight's 2020, right? Like you could look back and go, maybe I should have done things differently, and you might regret the way things went along the way. But in those moments, it's important to forgive ourselves and be kind to ourselves for any missteps that may have happened along the way. So anyway, this is my story. I'm hoping that you guys will be able to take something from this that will help you in your experience with caregiving. So,
and I'm just going to, pop in and ask just if anybody wanted to put this in the chat, but how do you feel that Stacey came full circle? I mean, and as far as your experiences as caregivers, may not be with a child, it could be with an adult.
We're seeing really good thank yous. Like, thank you for sharing your story. People seem really appreciative. So I know that can be really hard to kind of put yourself out there, particularly on Zoom when you're just kind of like going into the air. You don't get a lot of reciprocal. So I just wanted to make sure to share that. So for sure.
And I think, Stacey, we'll just keep moving along at this point. Okay, if you want to go to the next slide, please, Sheila.
Absolutely.
Thank you. So we heard about Stacey's mood, and I'm sure that as far as being depressed and overwhelmed, really is a thing. So as far as signs and symptoms of compassion fatigue, which Stacey's going to touch on as she experienced some of that, I just wanted to share a bit of information on caregiver depression. And both because it's World Mental Health Day and because depression must be acknowledged as a serious effect of caregiving. According to the Family Caregiver Alliance, a conservative estimate reports that 20% of family caregivers suffer from depression, which is twice the rate of the general population. In a 2023 study of military and veteran caregivers, it was estimated that of military veteran caregivers to those people that are 60 or under, 42% met criteria for depression. And that's almost 4 times the rate of non-caregivers. In this same study, 20% of military veteran caregivers to those 60 or under had thought about taking their own lives. Again, this is 4 times the rate of non-caregivers. So in our jobs, and I'm sure with Sheila and other professionals on this call, we have to really, really pay attention to that. I'll just put a little plug as far as the VA is concerned. We have an awesome VA SAFE program through the Suicide Prevention Department. And we include that in one of our caregiver caregiver support programs. So do people have crisis lines to share? We've got the Veterans Crisis Line, the regular 988, and then for veterans, you can press 1. Sheila, you want to put like the National Suicide Hotline?
Yeah, I've got it now. So right now in the state, everything's really being kind of like pushed to go toward, well, to 988. It even goes to like the Veterans Crisis Line. So it's like it's a nice short, 988. Yeah, make sure I said it right. The other day I said 811, and that's the dig line. So don't call the dig line. You want to call 988. So.
Yes, yeah, not the one that you dig in your yard kind of thing. All right. Any comments with regards to the depressed mood and how that impacts your caregiving? Okay, well, Stacey, I guess next slide with regards to signs and symptoms of compassion fatigue.
Sorry, there we go.
Yeah, and I'll just mention that this is the negative impact of caregiving. One of our objectives was to discuss the impact of caregiving. So although some people value their roles as caregivers, the negative impact can be heavy. Stacey and I have experienced this in our personal situations, and we talk to caregivers every day that are burning the candle at both ends. I mean, at some point, there's not going to be anything in the middle. And we strongly encourage our caregivers to do, like, attend a call like this or other programs or resources out there so that you're heard and validated in your roles. I think about the flashing light. I'm a word picture person. So the flashing light on your dashboard, if you're driving, it could mean you've got low tire pressure. Who knows what it could mean? Sometimes there's a little symbol, you don't know what it means, so you pull off to the side of the road. But when we're anxious or depressed, experiencing those feelings and emotions, it's time to, that's our body telling us that we need to pay attention. Pushing through is a lot of what caregivers do. And I heard a lot of, Stacey, that's what you did because you had to. There were just a lot of sleepless nights and a lot of coordination. And that's what you do as caregivers. However, our bodies are telling us that we need help. We need a break. We need to pay attention. So caregiving doesn't necessarily cause depression, but there's so many demands competing for our attention and energy. So that's how it can be an adverse effect. Okay.
Okay. So I wanted to talk about these signs and symptoms of compassion fatigue, kind of break them out one by one and sort of look at them. So for me, you know, there were feelings of grief and loss, you know, some depression, right, around the reality of him, my son, having liver disease and not being a, quote, normal child. And that's just not a one-time only deal. When you hear the diagnosis throughout his life, as things went on, there's constant reminders of that, right? Like, as I was explaining, like, you know, not being able to play basketball, you know, during medical visits, reminders that your kid is not normal when he goes to school and he's not able to make it through the day because of his health. Those are constant reminders to you, and there can be some grief and loss associated with that for sure. Before we had a diagnosis with my son, I had some situational depression, you know, waking up to the nightmare of my life. It really was like that. It was like I woke up and thought, I cannot believe this is my life. I'm in a nightmare. And then after transplant, when I returned to my life as normal, I really struggled to pick up the pieces and move on, and didn't know quite where I fit in. So for some caregivers, there can be other things to notice as well, right? Like, you know, changes in appetite, like eating too much, not eating enough, having less interest in activities that you once enjoyed, withdrawing from family and friends. Those are things to pay attention to there. Irritability and fatigue. Yes, that was true for me as well. I was a little bit irritable and on edge. I, you know, had a hard time talking about my son's transplant without crying. I realized I needed help through counseling. I felt overwhelmed. Often, you know, I questioned whether I had the inner strength to get through. I was fatigued, you know, exactly what Marcy was saying, lack of sleep, not eating on a regular schedule, being in the hospital, right? Running down and getting something real quick from the cafeteria or trying to take a moment for yourself is very tough. So, you know, at the hospital and after transplant, and then, you know, being his caregiver for weeks on end, the sole adult caregiver while my husband was in Idaho, I'm in California, completely overwhelming at times. You know, so a lot, we caregivers have a lot on their plate, and it's important to pay attention to these signs and symptoms of compassion fatigue. So caregivers sometimes put themselves on the back burner because they're concentrating on the care of their loved one. And sometimes they delay medical care or mental health care because they don't see a way to attend to their own needs while they're taking care of a family member. And so that can lead to compassion fatigue. I once worked with a woman whose husband had dementia, and she was struggling with her own mental health needs. And her doctor had prescribed an antidepressant, and she needed to get, it wasn't very effective, right? And so something needed to be done there. And she had a hard time finding a way, the time to get into the doctor again. I think she was concerned about the care of her husband and what she might do, or maybe even like the distance and how she might get to this appointment. She had a lot of obstacles that were kind of standing in the way there, a lot of obstacles to overcome. And so there are reasons that happens, but caregivers sometimes, unfortunately, delay their own medical care or mental health care because they're taking care of their loved one. So, yeah. So a few slides back, we talked about managing the effects of caregiving. And when you were thinking about that, maybe just also, we're also wondering how your response is kind of aligned with what we've reviewed on this slide so far. Anybody have any thoughts? If not, we can.
Well, I jotted down, Stacey, a few things that I saw people had mentioned with regards to not being in balance, just a lot of worry and, the internal issue that you shared of maybe holding it in or presenting well to others on the outside. So maybe that's like some stuffing or some, just keeping it inside instead of, because maybe like if you felt like it's like the boy with his finger in the dam, if you opened it up, everything would just burst and you wouldn't be able to make it to the next thing that you had to because you were holding it in. Maybe not the best way to handle
No, I'm positive there was some of that going on. I mean, that really tracks for me, for sure. Okay. So we'll move to the next slide then. These are some ways to manage the effects of caregiving, right? So, learning and utilizing stress management techniques, recognizing unhelpful thinking patterns, being kind to yourself, and learning how to set and maintain boundaries. Those things are important. So stress management looks a little different for everybody. It might be taking short breaks throughout the day just to breathe. Deep breathing and mindful meditation are helpful. It could be doing yoga and exercise. For some caregivers, they find it helpful to pray. I talk to people all the time who, do that, pray, read scriptures, things like that. Reading a book, watching a movie, doing hobbies, people find that helpful. I have a family member who cares for her young adult daughter with medical needs. And I was talking to her, she talked about the importance of finding a hobby or interest because that can be therapeutic. And then she also let me know that she finds like mental health therapy valuable for her to process her thoughts and feelings. And her advice in this situation is to really focus on relationships to people who are, or with people who are important in your life, lean into that a little bit. So it's okay to admit you're not okay, you're not doing well, and let people show up for you. So when people offer to bring in a meal or do something nice for you during the time you're having a really hard time, it's okay to accept that offer. Those things are a little bit difficult for me, right? And then we were talking earlier about maintaining your physical health, eating nutritious, kind of healthy meals, eating on a regular schedule. That's important because you don't want to put yourself on the back burner where you just don't have the energy or the focus to take care of the person, your care recipient. So I found it helpful to just allow myself 5 minutes or so to sit in my pain and feel the emotions. So I'd be driving, somewhere alone in the car, and I would let myself, as I was thinking about things and feeling things, just let myself cry for a few moments. Let myself scream, if I needed to do that, and just let out the emotion. I didn't want to live in that space because it would be all encompassing and not productive. But I did give myself moments to kind of acknowledge the pain that I was going through, really. So it's easy to fall into unhelpful thinking patterns, like wondering what you could have done differently, what you should have done differently, blaming yourself because you're not perfect, doubting your ability to provide the needed care. You know, I think that's something that caregivers often do. Like, can I do this? Can I get through this? Can I manage all of this? How am I going to do it? You know, believing you don't have any control over the situation, you know, so why try? That helplessness. So that can be a way to get stuck because it affects our ability to actively manage the situation and move forward. So it's important to pay attention to what we tell ourselves. If we tell ourselves things are awful and there's no hope and things won't get better, you know, that's not helpful. That keeps you from doing anything, and you're stuck. So if you need help changing the narrative, then get that help, you know, so you can be more hopeful and more positive and reach out to others to get the help that you need. So being kind to yourself. So it's extremely difficult to manage at times, and it's important that we give ourselves the kindness and the grace that we would offer to somebody else in these moments. Like, think of myself, you know, I'm a social worker, so, you know, I'm doing for other people. What would I tell somebody else in my situation, right? What would my advice be to them for self-care and for how they might manage and get through? So I did receive some valuable advice. My friend said, you know, put your arms around yourself, give yourself a big hug. It actually does work. I mean, it feels comforting to do that. So, you know, even if you are alone, like I was when I was in California, right? I was by myself a lot of the times, and I was able to do things like that to just give myself that comfort and reassurance. Expressing how you're feeling through journaling can be helpful, or, you know, having someone to talk to and getting the words out. Feeling the emotions, we talked about that when they come up, giving yourself some time to kind of feel that and acknowledge that and then move on. So forgiving yourself of your shortcomings, because we're only human, right? We make mistakes. We do our best with whatever information is available at the time. I mean, we don't have crystal balls. We don't know what the future will bring. We're just doing our best in those moments. And then with boundaries, it's essential to maintain boundaries. You can't be all things to all people at all times. So if you're a caregiver and, you know, somebody is needing something, it's not an emergency, you might want to establish a boundary, like, you know, that you're not going to just jump up and assist in that moment, and let them know when you would be available to help out. When I talk to caregivers, they tell me this is one of the most difficult things, right? As soon as they start cooking dinner, as soon as they start doing something, then their care recipient needs something. They need help. They need, and then, you know, there they are putting themselves on the back burner and jumping to do something for their loved one. But you can't constantly do that and meet other demands of somebody else. You have to put yourself on the list as well. So sometimes it's okay to take a moment for yourself if that person can wait. And in addition to establishing boundaries with the care recipient, it's also helpful at times to establish boundaries with family and friends. So when can people stop by, right? Like, I found it helpful to have friends and family stop by the hospital and visit me. But do you need to put times around that? Does that need to be organized in some way to be most helpful to you? What kind of help is actually the most helpful? People might want to be there for you, but just kind of need help in figuring that out. So, yeah. So in this day and age as well, it's important to consider the boundaries that we have on social media. So how much do we share? That could be a whole other conversation, but just quickly, you know, how much do we share publicly about these situations on Facebook or Instagram or whatever? You know, what is our information to share? What doesn't violate the privacy of the care recipient? And I'm not sure there's any right or wrong answers here, and it might be different, you know, due to different situations. But after my son's transplant, when I was kind of alone in California and not not having as much interaction, right, with family and friends and definitely not in person as I had before during these times. I was in need of support, and I thought, about putting some information out there like on Facebook, but then kind of weighed the pros and cons of doing that, right? And because my son was a child, I didn't feel like it was my place to disclose his medical information on, such a public forum. So those are things to sort of consider, right? You need help. Maybe that's not the way to get the help. Maybe there are other avenues to meet your needs without putting it all out there. And, just so you know, I did share his story. So just to clarify, I did go to him and got his permission to kind of talk publicly about his situation and what we had gone through, also to share those pictures. So just so you know that. And then as part of that, Marcy and I are asking that if people are downloading the slides from today, that it's blurred out, or those pictures are not available for.
Yeah, we're gonna omit the picture. We omitted those slides, so we're good to go.
Okay, for the end of time to be out there in the public forum. So anyway, because it is kind of a personal thing. So again, managing the effects of caregiving. This is kind of a continued slide. So problem solve productively, build margin into your day, and utilize respite when you can. So, productive problem solving is kind of, how do I utilize the resources that are at hand? And just from my situation, when my child wasn't able to continue breastfeeding, he was a baby, we had to use a special formula. There were only 1 or 2 stores in the area that carried it. It was a problem with having it stocked and finding it available. And that was when the internet was just kind of the internet had been there, but, maybe I was less used to buying things on the internet. I think we all kind of were at that time. So, sometimes it was talking to local stores about, having the formula, then going and picking it up. And one time when my mom was on her way, to stay with us, I had her swing by like Twin Falls, one of the stores, and pick up the formula and bring it. And so kind of problem solving, right? Because we just don't know what the next day will bring, but we need to be ready to handle the challenges that kind of come our way and think through it. When my insurance didn't, they said they wouldn't pay for the hospital that he had his procedure, his surgery when he was a baby, and the partial splenic embolization. My insurance company said, we won't pay for this hospital to do the liver transplant. Okay, back to the drawing board, right? Talking to doctors. What do you think? Where would you go if this was your kid? What would you be doing? Taking all that into consideration, trying to get the research, the facts and the figures, the success rates. I did all of that. I'm a little bit weird about that, but so making an informed decision and kind of problem solving those kinds of things, and breaking, those big problems that come your way into chunking them down into manageable steps, I think is helpful. So building margin into your day is, that can look like not overbooking yourself, allowing adequate time to get to appointments, because it might take more time to drive there with traffic and construction and delays, and, getting in the vehicle, out of the vehicle, finding parking, walking into the appointment. And I think, managing that as much as you can, having a little bit of forethought there goes a long way to keeping yourself in a place where you're feeling able to, like your best self, and able to tackle what comes your way. So planning for those unexpected delays and be realistic about the time it takes to get things done. So sometimes we have to work within the time constraints of other providers and programs, right? So knowing you have to get something done by a certain date, don't wait, and build in margin into the time. So again, with the liver transplant and trying to okay, we got to go to the drawing board about the hospital. I can't sit on that forever, right? I have to hurry up and kind of make a choice there so we can be moving on and doing the best that we can do. So also scheduling time for self-care, because it won't happen if you don't do that. Like, you know, your day will be consumed and you won't have time for yourself. So building that in and putting yourself on the list. Respite care, I'm assuming that people know what respite care is. And if not, just briefly, respite care is when somebody kind of comes into the home and sits with the care recipient, so you as the caregiver can get a little bit of a break. So caregivers use respite care because it relieves caregiver fatigue and it helps to prevent burnout. So taking care of yourself first, right? Putting on that oxygen mask for yourself before you do, like they teach you when you go flying in a plane. You have to take care of yourself first before you can take care of somebody else. And if your well is run dry, then you don't have anything to give to anybody else. So the VA does offer respite care, and sometimes people pay for respite care on their own, you know, through community agencies. So family members, friends, people like that, you know, natural support systems are also people to turn to kind of chip in a little bit, provide a little bit of respite to help free the caregiver of the caregiving responsibilities so they can go to their own appointments and, you know, manage what they need to do, visit family, friends, take a moment to themselves, get a cup of coffee, whatever it is. So respite care can really be beneficial. And we've seen it have an overwhelmingly positive response for caregivers who are using it. So, okay, next slide.
All right. Let's see here.
I think right at this point, since we have just a few more minutes left, Stacey and I just wanted to really briefly go over, because some people aren't aware of the program of caregiver support at the VA. And so really quick, I just was going to go over the part that I do, which is the program of general caregiver support services. So in order to be enrolled in that, the veteran has to be enrolled in VA healthcare. He must need assistance with activities of daily living or require supervision or protection. And he must agree to receive care from the caregiver. So it's a pretty straightforward, and also for the veteran does not have to be service connected to receive services, as long as he or she is receiving care at the VA. It's a pretty quick process, about an hour of time, and then it opens up that caregiver to receive all the education, skill building, and supports that we can offer. So.
Alrighty.
Okay, then real quick for Stacey, your program.
Yeah, so I work within the program of comprehensive assistance for family caregivers. So that program is a little bit different, and because for eligibility, somebody must be 70% or more service connected. So I'm not sure if everybody knows what that is, but tracing, you know, the military, the veterans' time back to their time in the military, they have to have something that is connected to their time in service, as far as an injury, illness, condition, that kind of thing that happened during the military or as a result of their military service. And so they need a service connection rating of 70% or more. And they need to have a family member or somebody living in the home providing care. That is something that we look at as well. And when we're looking at eligibility, we're looking at, you know, do they need assistance with activities of daily living, like each time they perform activities of daily living, like feeding, dressing, bathing, toileting, grooming, or do they have a need for supervision, protection, and instruction? Those are kinds of the things that we look at when we're considering eligibility for our program. And for people who are approved for this program, there is a monthly stipend for the caregiver. So it's quite an assessment process. We have 90 days. So we look at a lot of different things, do a lot of assessments. And for people who are approved, there is money every month for the caregiver. So basically kind of like paying the caregiver for the work that they do. But also within our program, we also have all of those same things Marcy was mentioning with support, skill building, education, all of that is available within our program as well. Yeah, Marcy is good at doing those kinds of classes and events and things. Okay, Marcy.
At this point, we just have 5 minutes. So I'm just going to really quick, if you ask for a copy of the slides, we've got some, our online, our website that has tons and tons of information. We've got some resources and references listed. Does anybody have any questions at this point? We've covered a lot of material. You guys have been awesome.
Great resources here. Yeah.
Yeah. So is there anything really quick that you had any questions about?
No, and a person or two dipped off and just said, thank you so much. I love this class. Thank you. So I'm seeing the thank yous. I just know that when time gets tight, it's like, people start dipping off.
Yes.
No, I understand that.
Yeah. Okay. Well, we've enjoyed being able to have this opportunity, Sheila. Thank you.
No, thank you so much from all of just on behalf of all of my colleagues. This has been a really great presentation today and really informative. I'm seeing a lot of good stuff in the chat. I'm seeing one question. Can a veteran get help with a care receiver, with their own care receiver with a child? Am I reading that right? Can a veteran get help with their own care receiver, a child? I'm trying to, Gail, I might have to go. We're happy to kind of.
A veteran providing care to a child?
Yes.
Not within our program.
Darn it. Okay, good to know.
Marcy, can you think of any resources there for veteran caregivers of children?
Not specific to veterans, but we could probably provide some support as Family Caregiver Navigator and get them connected to some local respite resources, whether it's through the YES program or something like that. So we're happy to. I'll put our information in the chat as well, Stacey, to kind of our information so you can get a little more information. So give us a call.
Right. I was just wondering if Marcy had anything to add. Sometimes she'll deal with opposite situations where it's like a veteran providing care to his spouse who's not a veteran. It's like a reverse scenario.
Right. And in that case, unfortunately, they are not eligible for, yes. It has to be trained for a veteran. Yes.
But
that's a good question, Gail. Thank you. Yeah.
That's why we have partners, so we can refer to partners like Family Caregiver Navigator and the YES program. And I pulled some different things out there I think we could look at. So then I'll put our information in the chat. You're welcome to reach out to us as well, Gail, and we'll get that worked out with you.
That's great.
Okay.
Cool. Yeah, and Brandon, I think you decide about sharing. We're going to definitely share the recording and share the information. This one might take a moment longer to record because maybe we're to send out because we're going to have to do a little tiny bit of editing to make sure Stacey's son isn't called out. so we'll have to figure that out, but we will make sure to get this out for sure. We'll get it posted and ready to go. So. But yeah, other than that, thank you so much. And I hope you all have a way to recognize World Mental Health Day, as our own mental health is so important these times, at all times, and we'll just go from there. But